to this webinar. This is the fifth webinar we have had on COVID-19 since the whole pandemic started. I will be sharing my screen now so we can have okay. Can everyone please mute their mics?
Okay, yeah.
Okay. So for those who are just joining us, this is the International Society of Media in Public Health. To give a little bit of an introduction, so it's an NGO that was founded about 3 years ago, and the role of the NGO is to mainstream the media as a tool to accelerate healthcare information. So what we do basically is we cover news and information around healthcare, around food, around science. And our founder is Shipmoji Makonjola. I don't know if you guys know her, but she has always been a veteran journalist, and she has covered a lot of areas around healthcare and agriculture. So basically what we do is to do health advocacy and provide information to people in rural communities, to do one-on-one engagement with people all over Nigeria about health. We also conduct awareness campaign in rural areas and low-income communities, and we address all issues of public health. That is why the topic housing is very strategic for us today. So the third thing that we do is to build capacity. So usually we'll carry out capacity building with people in the media and try to help them disseminate clear information around public health. So today, I'm very excited for the wide range of speakers we have today. We have like high impact people, which is making me so happy. We're going to be talking about the impact of COVID-19 on housing and healthcare. As we all know, every human being, we have three things that we all need to be healthy: access to food, access to health, to shelter, and access to clothing. So we'll be talking, last week we actually spoke about access to food. So today we are facing the housing area of it. And we have a wide range of experts, housing experts, that will be talking to us today about this. I'll go ahead to introduce them when the panel starts. So, but as an overview of the part of the program, so first we'll have architect Olarewaju Godman. I'm sorry if I murdered your name, architect. But with architect, we'll be talking about, we'll get to understand the current realities of low-income housing in Nigeria. And we'll also see what policies and systems are in place to help protect the vulnerable people all over Nigeria. Then next, we'll hear from Mary Ukam. Mary is a housing and development enthusiast. She is going to be telling us about the risk around COVID-19 and excuse me, and the entry points, the short, midterm, and intervention that can be used to promote safer cities for families. Then next, we'll be talking with Matthias, Anaja, Jonathan, and Theophilus Aristarchus. Wow, this is a foreign name. Okay, so Antimoji is the executive director of ISMPH. So we would like to hear a few words from you before we start.
Okay. Well, first of all, let me just thank you for putting all this together again. And I do hope that we'll have a robust conversation that can be proactive. That is, I want us to have actionable conversation, not just for the sake of putting up a meeting, but that things that really can be proactive for us to use. On behalf of ISMPH, I'd like to thank the panelists for agreeing to come to give us another learning curve. My expectations are that at the end of this, we'll be able to compile together all that we have been able to learn, and going forward, the education that we also can impact on other people. I would not want to take too much of your time since participants are really going to have some time again to talk, but I want to thank you all for putting this together, and I hope that we'll have a wonderful time together.
Thank you so much. So for our first speaker, we'll be calling on architect Olarewaju Godman Olusola. He is a registered architect with the Architects Registration Council of Nigeria and a project management consultant with over 30 years of professional experience. And he has built his environment in different ranges of work, and he has consulted also for significant projects in various parts of Nigeria, as well as the United States, ranging from small maintenance jobs to multi-billion naira design and building assignments. He was a quality control manager and later a project manager for Dynamic Corporation LLC, Hyattsville, Maryland, USA, on the US Embassy Knox Abuja Docks project. I'm sorry if I'm not mentioning this correctly, but they all look like very large projects and it's a big one. So architect Lanre is a certified management consultant and a fellow of the Nigerian Institute of Architects, NIA. He's a fellow of the Institute of Management Consultants, IMC, and Nigerian Institute of Management, NIM. He's also a member of other professional bodies such as the Project Management Institute, BMI, American Institute of Architects, AIA, and Association of Consulting Architects in Nigeria, ACAN. Architect Olusola has also actively participated in various local and international courses and workshops on architecture, construction, leadership, investment, and project management in Europe, Middle East, Africa, and North America. He is currently the country representative in Nigeria for the American Institute of Architects, and he's a committee chair for the Nigerian Institute of Architects and the International Affairs and Assistant Secretary General, Association of Professional Bodies, Architectural Professional Bodies of Nigeria, APBN. So, Architect Lanre, we are so glad to have you here. Welcome to this panel. So you have the floor.
Thank you, Modesta. I hope I'm visible and I hope I'm audible as well.
Yes.
All right. I was almost getting choked by my own introduction. I was like, who is this that is being read out so much to hear concerning just one person? But I'm humbled by that. Not to, in all modesty, to say that it's been a product of many years of practice and service to humanity mostly. First of all, my name was not murdered, but was actually massacred by Modesta. There's permission to do that. After all, I'm sure you've left Nigeria for quite a long time now, so you may not remember how to call our names in Nigeria anymore. My name is Olanrewaju Olusola. I am a Nigerian and a Yoruba man. All right. And I'm privileged to be here today to talk on this topic of current housing realities and actions for safer cities and communities during COVID-19. This is a topic I understand that has been brought under the general theme set up by the International Society of Media in Public Health, ISMPH, a series on impact of COVID-19 on housing and healthcare. When I got this topic to speak about, I began to think in my head what really is there to say, especially when I was informed that I have some areas of focus under this same topic. These areas of focus are the current realities of low income housing and informal settlements in Nigeria, as well as policies and systems in place to protect the homeless and vulnerable during COVID-19. So I had to limit my research and study to these two areas of focus because of limited time. This is not a seminar paper, it's basically a discussion on these matters, and it is not an authority in these topics, but it is an opinion, a considered opinion based on empirical findings within our society. My area of focus is to talk about these effects and these impacts in Nigeria. So I'm going to limit myself to all of these. I would start, Modesta, if I may, by going through what I call the introduction into the paper. According to the Center for Affordable Housing Finance in Africa, and they said, housing remains a perennial problem in Nigeria, despite improving macroeconomics. Housing situation in Nigeria requires an emergency response in the face of a projected population of 263 million by 2038. Governments across regimes and administrations have made various degrees of efforts to ameliorate the gaping housing deficit through diverse interventions. We know over the years this has been done across governments, even beyond the democratic rules that we have in this country. I remember the Shagari housing estates back in the day. I remember the Jakonde housing estates back in the day. I happen to come with a few of some decades, so permit me if I say things that sound old school. Yes, but that's part of the experience. Now, notable among such interventions, especially in recent times, is the creation of the Family Homes Fund, what is referred to as the FHF, in 2018 by the current Buhari administration. This is a PPP, which means a public-private partnership housing brainbox facilitated by the Federal Ministry of Finance and the Nigerian Sovereign Investment Authority, NSIA. This initiative has the commitment to facilitate and supply 500,000 homes and 1.5 million jobs for low-income earners across the country by 2023. FHF, in recent times, has developed about 650 housing units of low-income housing in Asaba Delta State. This is amongst numerous low and medium-income housing schemes that are spread across various geopolitical demographics in the country. Now, the FHF and Nigerian Institute of Architects also recently signed a memorandum of understanding to access the pool of professional services within the association to provide fit-for-purpose, standard quality, affordable designs and tailored project management services for their housing schemes nationwide. Stakeholders, however, have decried various government neglect of the informal sector of the value chain. Ironically, with a GDP of 530 billion US dollars and still counting, and a GDP per capita of 2,028 US dollars as at 2018, the largest economy, which is Nigeria, in Africa, generates 65% of our GDP from the informal sector. Now, Nigeria needs a definitive structure that can attract such revenue that will help bolster the housing market. We're talking about the informal sector, the informal settlement in terms of housing. So government is not going to do everything on their own. We're going to have to invite a whole lot from the informal sector, seeing that our GDP has about 65% of its generation from the informal sector. As posited by the same CAHF, that's the Center for Affordable Housing Finance in Africa, the country will create a significant leap in the provision of affordable housing if the informal sector operators, who make up 83.2% of Nigeria's 81.15 million workforce, if they are allowed to be part of a contributory pension scheme. We know that Nigeria has a contributory pension scheme at the moment, but we know that the catchment net is quite abysmal compared to these 81.15 million workforce that we're talking about. This has set up a bit of a background for what I am going to talk about, the areas of focus. And the first area of focus will be the current realities of low-income housing and informal settlements in Nigeria. Now, if those are Adebayo, the CEO of FESADEP Communications and the convener of Abuja International Housing Show, a show that has been on for about 12 to 13 years running. He recently said, it is clear to all of us now that it is not only in the health sector that Nigeria has an emergency, it is also in housing. Many Nigerians are homeless, many sleep under bridges, many in shanties under subhuman conditions. That is enough food for thought. But we could expatiate further and explain and say, look, the deplorable state of informal settlement, better referred to as slums. We know that in Nigeria, we have various degrees of housing settlements. We have the low cost, medium cost, and the high cost housing settlement. Now, amongst all of these, we're not even talking about the informal settlement here. The informal settlement does not even fall within any of these low cost, medium cost, or high cost settlements. The informal settlements are settlements that grew either from nature, organically, or settlements that came to be due to migration because of urban drift, settlements that are unplanned in any way you could think about planning. Now, the deplorable state of informal settlements, quite deplorable, I must say, better referred as slums, is especially in urban metropolis, has never been better revealed than during the lockdowns occasioned by ad hoc bylaws towards flattening the COVID-19 pandemic curve, when many residents in formal settlements found themselves in catch-22 situations, daring the deadly unseen enemy because they did not have comfortable
Okay, it seems Architect has a network problem.
We all know that Nigeria have put in measures. Some of these measures entail asking everyone, am I still, Modesta, am I still visible? Modesta, you are muted.
You had a little bit of freeze, but we can hear you now.
Okay, but I'm okay now. Can I go on now?
Yes, please.
All right, I'll be fast with it now. Now, we all know that governments all over the world have put in measures to flatten the curve of the pandemic. One of the major measures is asking everyone to sit at home except you have essential duties to perform. So this sit at home measure, when you take it to the informal settlements in Nigeria, specifically in Nigeria, you find out most of the people that live in these informal settlements have found between the devil and the deep blue sea kind of situation. They need to sit at home. However, there is no home really to sit at. Secondly, they need to feed themselves because they live from hand to mouth. So they cannot afford to sit at home naturally and ordinarily because they subsist on what they make on a daily basis. So if they sit at home, they will not be able to make anything. That means livelihood is cut short for them. There are no savings. There is nothing to fall back on. They need to work in order to make money to be able to feed themselves and their families. So that's the catch-22 situation they found themselves in. So they dare to go out, to look for something to do. Albeit going out there is nothing to do because everybody else is sitting at home, one way or the other. So it is so precarious for those who live in the informal sector to be able to observe the sit at home guideline being set up by government. Now, all tiers of government should guarantee the right to basic necessities. This is a given. I mean, what are these basic necessities, such as food, shelter, hygienic environment, and sustainability of livelihood for those who are homeless, those who are jobless, and for those people who will lose their jobs or income during the COVID-19 pandemic. Millions of Nigerians observing the COVID-19 lockdown lack most of these basic necessities. They also lack the financial power needed to survive. Now I'm going to take us through the kind of deplorable state they live in so that we can all understand what we're talking about. When government was announcing the lockdown, President Buhari said the government would put in place the livelihood of workers and business owners to ensure their families. Mark those words if you can. He said conditional cash transfers for the next and social development Hajia Sadia distributed to vulnerable households. But they are immediately right now. This measure will need economic and social interventions. Wait for it. 11 million households. Though it's been expanded to 60 now households. This is a far cry from the over 90 million. If you divide it by 6, gives you 15 million households, Nigerians estimated to live in extreme poverty on less than $1 a day. Now, what are the measures that have been put in place by government? We need to understand that. These are the measures. up until recently, government has turned out 77,000 metric tons of food that will be distributed to vulnerable households in Lagos, Ogun, and maintenance of the school feeding program, which started a few years ago. Government said they're going to maintain it even during this lockdown. State government's distribution of food packages and palliative. We have myriads of this. All kinds of private sector palliative initiatives. I will not bore you with details on that. Now, Central Bank also recently announced a 50 billion naira targeted credit facility to support households and micro, small, and medium enterprises affected by the COVID-19 pandemic. However, listen to this. This credit facility, through which households can potentially access up to 3 million naira loan, requires proof of collateral, such as personal property, which many poor families are unlikely to have. The loans also come with a 5% interest initially and 9% after March 2021. Only 40 million Nigerians, which translates to 25% of the population, or 45% of the extremely poor population, have a bank account. So tell me, how many of these people will this CBN 50 billion credit facility get to? All right. Now, also part of what's being done by government, the House of Representatives passed the Emergency Economic Stimulus Bill 2020 to provide 50% tax rebates for employers and business owners who agreed to not make staff cuts in 2020. This is where some of us fall in. You know, I'm an employer of labor, and we've been all home for the last 3 months doing nothing tangible, tangible. Because we build houses, we design and build houses, and we are not part of the essential people that could go out there and work. Essential services, rather. Now, this is what the House of Representatives have done. Now, while the bill, if it goes into effect, may prevent job losses in the formal sector, it contains no provision for the informal sector. That bill. So there must be a tweaking of that bill. Now, in terms of economic crisis such as this, governments must demonstrate that they have made every effort to mobilize all available resources, including international assistance if need be, and allocate them in the way that maximizes respect for human rights, including by taking cognizance of the precarious situation of disadvantaged and marginalized individuals or groups, especially those who live in the informal settlements across the country. Nigerian governments should develop plans to develop socio-economic assistance to the tens of millions of people who live in low-income and informal settlements, who lack an adequate social safety net and basic hygienic environments. These measures should be developed in conjunction with community-based organizations with experience in serving people living in poverty. I'm going to explain this a little bit and I will end because I know my time should be up any moment from now. If you want to understand what the informal settlement in Nigeria is, look up the word squalor in any dictionary. Then you will begin to have an idea of what the informal settlement in Nigeria is. There is no access road, no drainage system that could work, no sewage system that works, no public potable water supply, epileptic electricity supply. Now, these are not indictments, they are realities. And I stand to be corrected by anybody, for I have lived in this country and I have worked in this environment for over 30 to 40 years. When you see the situation where a family of 10 live in one room of 10 to 12 square meters, and that family have to share conveniences with about 5 to 6 other families, toilet and bathroom and kitchen. That is the picture of the informal settlement anywhere in Nigeria, if not worse. And there is no form of maintenance for the services in these areas. Now, in the days of community spread of the COVID-19, just picture in your mind if one person within that family and in that neighborhood has COVID-19, how many people will this affect? We're talking about the impact of COVID-19 on housing and healthcare. And do we as a country, as a government, all tiers of government, local, state, and federal, have the infrastructure to take care of this community spread of COVID-19? The answer between you and I is an obvious no. Now, the time is now. All the palliatives that the government has been doing have centered around food, have centered around money, centered around maybe protective equipment, face masks, and all of that. Nowhere have we heard, I haven't heard, where government says they have gone to the informal settlements to make sure that the hygiene of the environment is improved so as to stem COVID-19 spread, to deploy resources. They need to deploy creativity so that the basic necessities for everyone is guaranteed, especially in the informal settlements and in the low income and areas. Thank you, Modesta. I think I would break my pencil at this point. That's what we say in architecture studios when you're done with your drawing.
Thank you so much, architect. I wish you all can clap from wherever we are, but this was a great presentation.
Thank you very much. Thank you very much.
Yeah, good. Well done.
Thank you. So I know, so this is actually not going to be a one-way discussion. It's going to be an interaction. So we are going to open the floor for everyone. I know we have a lot of questions for architect, but before then, we want to take other panelists. So for now, if you have any burning thoughts or questions, please put that up in your chat section. I already see some comments from some of our participants. We'll call you up to make your own thoughts and comments about this later. Okay, so now we'll be calling on our next panelist, Mary Okam. Mary is a development professional passionate about livelihoods, housing, and the built environment. She's driven by a purpose and a clear vision to positively impact individuals and to build the environment. And she believes in using her skills and expertise to provide services that solve problems and ensure sustainability, while creating opportunities for the advancement and development of different levels of the society. So her career so far spans from, she got a graduate degree from architecture, and she has been involved in the agricultural sector. So most of what she does is to reach out to communities, to do high impact programs around agriculture, technology, housing, design and implementation of affordable housing in Nigeria. She has also worked to help in promotion and implementation of different policies and programs that will ensure a better environment for Nigerian youths and women. So everyone, please join me to welcome Mary Ukam. Mary, you have the floor.
Welcome. Mary, you're welcome.
Hi, Esther.
Yes.
Thank you. Thank you so much for that introduction. I'm very glad it's not lengthy, but it's okay. Thank you. So do I go ahead and share my screen, or do you want to do that from your end? Okay.
You can do
So
that.
just 1 second and then we'll get started.
Are you able to do? Okay. Good.
Yes. Can you see my screen?
Yes, we can.
Yes, I can.
Okay, fantastic. Okay, so hello everyone, and thank you so much for joining this conversation. Before I start, I just want to say a big thank you to the International Society of Media and Public Health, the Secretariat, and Modesta as well for the opportunity to share my thoughts on the topic that we're discussing, the impact of COVID-19 on housing and healthcare as relates to actions for safer cities and communities. Basically, I'm very pleased at what's happening now because it seems like this pandemic is, causing us to rethink the way we make decisions, that affect human relations. And you can see that in different world organizations that are, beginning to look at multi-sectoral linkages and key actors in how they can design solutions, for this virus and this pandemic. Key for me will be, the collaboration between UN Habitat and the World Health Organization, especially as it relates to this topic that we're discussing. And of course, back home here, ISMPH, trying to, listen to the built environment actors and professionals in Nigeria to learn about what's going on and how we can collectively come up with solutions that can work for us, here in Nigeria. So I have just a few slides. I'm not going to take so much of your time because I'm actually looking forward to the question and comment section. I really want to know what, other people are thinking of. So this is my outline. My talking points will revolve around underlying housing and environmental challenges in informal settlements, as well as entry points for short, mid, and long-term interventions for safer cities and communities. And then I'll, of course, share some key takeaways I think we can have in mind going forward. So the world as it is, we know that as professionals in this space, we've come to understand that over 40% of the urban growth worldwide today, is in slums, and nearly 1 billion people live in informal settlements. Like architect Olarinwaju rightly said, up to 65% of our nation's GDP is being contributed by people in the informal economy. And where do these people majorly reside? Informal settlements, for different reasons, reasons surrounding income, livelihoods, opportunities around jobs, and all of that. So it's really important for us to consider the health risk around housing for people in informal settlements, in a way that is systemic, such that we can have lasting impact, going forward. So housing is one of, the most important components. Like Modesta said in her introduction, shelter, food, and clothes. Housing is one of such key components for every human. I personally like to think that a house or a home is the first line of defense for anyone when they are faced, in an attack. And we saw how that, or we are seeing how that is playing out, especially in this period where the pandemic, is growing strong across the nations of the world. And so even in trying to curb that spread, the first thing that, professionals in the health sector will think of is to ask people, to stay at home while they try to, get solutions to this problem. So we see the critical role that housing plays. And we also see the interlinkage in housing and healthcare. We know that housing is also one of the social determinants of health, and it plays, a critical role in the health outcomes of its inhabitants. So this nexus between housing, environment, and healthcare is actually one that has existed before now, but it's interesting because the pandemic has kind of put the spotlight on it, which is good for every professional in this space, because now it seems like we have the opportunity to make that change that we so desperately want to see. So I don't want us to look at it like it's something that just started because of the pandemic. It's something that actually has been there, most of the issues around housing, environment, and the interlinkage with healthcare. But the pandemic is making it, something that is at the forefront now. And then also the whole idea around informal settlements, being stigmatized because, of course, that is where you have a higher percentage of low-income earners living. You have a lot of issues, concerning their environment, the nature of the space that they live in, the quality of the building that they live in. So they're actually, mostly stigmatized and overlooked when it comes to planning and development agendas. So before I go into sharing with you some underlying housing and environmental challenges that I think exist, of which most of them are not novel, like I didn't invent them, they've been there, but I'm just highlighting it based on this discourse. I just want to give you a brief, how do I put it, background. So like many cities in the global south, we know that informal settlements are almost indispensable, indispensable parts of urban areas. There's no city or urban area that you go to in Africa that you won't find at least one informal settlement. Nigeria is no exception. And the unfortunate thing is that these settlements are not, like I said, they're not considered as part of areas that governments, agencies, development agencies focus their energy on. So they're overlooked in terms of provision of basic infrastructure, in terms of housing facilities, social housing facilities, affordable housing facilities. They are overlooked in terms of social infrastructure, good roads, schools, health facilities, and things like that. And the unfortunate thing also about this is the fact that ignoring this group of people is actually very harmful, because most of the people who live in this settlement actually work outside of the settlement. So I want you to begin to imagine the magnitude of risk that we are actually looking at when we're talking about people living in informal settlements, not getting the kind of attention they need, especially during a pandemic like this. So if you have people who are living in these informal settlements, moving out of there to the city centers, who are getting all the attention in terms of safety protocols, in terms of health guidelines on how to mitigate the virus, you have these people moving from that place every day to this other space, interacting with these people. Imagine the level of transmission that could occur, during a pandemic like this. I was privileged during the lockdown to go to some of these informal settlements. I went to about 5 of them here in Abuja, where I live and work. And I had, the opportunity to firsthand interact with some of these dwellers and find out from them, what has been going on since the pandemic started. So it was an opportunity for me to conduct a rapid scoping fact-finding survey. I used the approach of key informant interviews because I knew, and because of the protocols, I couldn't talk to as many people as I wanted to. So I had to select some key people, some women, some men who had key positions in the community, to find out from them, what has the government done? has any civil society come around to provide some kind of help, support? Is there any initiative that has started in your settlement that is helping to mitigate the risks of the spread of COVID-19 in the settlement? I was interested in mapping out some of these challenges and seeing how we can come up with solutions. I may not be able to do everything, but I could lend my voice to the situation and bring help, hopefully. So basically what I'll be sharing with you in the next few slides are some of the key findings that I got during my visit, and some of the priority areas that the people mentioned that will be entry points for interventions, programs, projects, or supports that they would appreciate. So like I mentioned earlier, the issue of housing, environment, and healthcare is so interconnected that if you have a problem in the environment, it doesn't matter how good your house or your building is. One way or the other, you're exposing yourself to public health diseases or issues, in that space. So one of the key things I discovered is that the density of housing in these settlements and the household and social structure, like architect Olarinwa just said, you find out that there's a 1-bedroom apartment, but you have up to 6 people living in that space. Now you begin to wonder, how will these people effectively adhere to the COVID-19 safety protocols or physical distancing? It's almost impossible, And then also you look at the proximity and high levels of social and physical interaction, because you're living in such an enclosed, crowded community. Everybody seems to be going in the same direction, either to fetch water or to buy stuff in the community market. So, all of these things, play a role in increasing the levels of transmission of a virus like COVID. Also, limited infrastructure when it comes to water supply, even medical facilities. I mean, of the 5 settlements I visited, not even one of them had like a basic medical facility. So I asked myself, if there were to be a recorded case of someone having the virus here, how would they go about isolating that person? How would they even think of trying to manage the case before they get to like a bigger hospital? And also, critical thing that stood out during my visit to this place is that some people also mentioned the fact of tenancy arrangements and evictions from landlords. So where they are having the challenge of movements to access their place of work and a living and all, their landlords are not even trying to be caring, if I may use that word, to say, okay, because you can't work for XYZ months, we will give you the grace. Some of them are having to be evicted from their homes. So where do they go to? So these are some of the challenges that I was able to highlight during that period. Concerning the environment, it's glaring. There's almost no informal settlement that you will go to and you won't find critical issues of waste collection and disposal. Most of these settlements don't even have drainage systems. So everybody dumps garbage wherever they find the space. And especially now that's this rainy season, you can just imagine what some of these settlements would look like and the kind of diseases that, those communities will be breeding, in such kind of spaces. So other issues, other underlying issues concerning the challenges that people in informal settlements are facing right now are the pressures on livelihood. So you can't go out because of the restrictions to work. Your income is affected. You can't pay your rent. You can't pay bills. There was a community I went to and they said, look, we've not had power supply for the longest period ever. So you now imagine, how will these people even live, So I'm going to take you now into some of the interventions that we could begin to implement, whether it's government, whether it's private sector organizations, NGOs, civil society. I think these entry points are really critical to having lasting impacts as relates to the subject that we're discussing. So this quote, someone mentioned this, I couldn't get the name, but it stuck with me because it's so apt. Times of crisis should be seen as an opportunity to either develop better systems or enhance the frameworks that we use in inclusive planning and management of informal sectors. The era of stigmatizing informal settlements is gone. You cannot continue to demolish informal settlements in the bid to just discourage people from settling. As long as there's still that rural urban migration, as long as the realities of urbanization exist, you will continue to have informal settlements. So it's in times like this that we look out for opportunities, we look out for ways, ideas, on how to make things better, rather than saying, okay, if this place is going to cause us problems, let's just wipe it off and be done with it. So these are a few entry points, but before I even start discussing this, I just want to say these short and mid-term interventions, entry points for interventions, should not be considered as a one-off approach, something you just do and go, but it should have a more long-term approach such that everything builds up one to the other, and at the end of the day, we have a holistic system that gives us the kind of change that we seek to see. So we'll start with the short term. Public health literacy, we cannot overemphasize that. So what I've noticed during this pandemic in Abuja, for instance, or let's say Nigeria, is that a lot of attention is being paid to city centers, which is good. Nobody is talking about, for instance, the rural space. So I beg your pardon to deviate a bit. This is what is passionate, to me. So I'll just mention it in passing. Nobody is talking about what's going on in the rural space. Nobody is talking about the informal settlements, how they are coping. And I totally agree with architect Olarinwaju when he said, he finds it hard to believe that, during this period, nobody has gone to these settlements to even ask them what's going on, how can we help, how can we support? And that's the reality on ground. I was interacting with some of the residents in Gosa village along the airport road. If you're in Abuja, you'll be familiar with that place. And they said, yes, palliative came, but it was nothing to write home about. Cups of gari, cups of rice, that some of them even refused to take it, that's not what's going to keep them. So, but back to the point, public health literacy, some people still do not believe or accept that COVID-19 is real, especially in these settlements. In fact, one of them told me, because when I went out, I went with my face mask, and I asked, why are you not wearing your face mask? How are we sure that COVID-19 is even real? So public health literacy, beyond the washing your hands, physical distancing of up to 2 meters, using alcohol-based sanitizer, they need to know that COVID-19 is real. And I don't blame them, because most of the cases we've recorded in Abuja, for instance, there has not been any disaggregation of data to show where the incidences of these people who are affected, are from. So how do you now convince somebody that, okay, your community is prone or is exposed to, the virus? Nobody's going to believe if they don't see the data, if they don't see the evidence. And that leads me to the second point, data gathering, mapping, and knowledge. So in times like this, data collection cannot be overemphasized, because it's with good data that we can design interventions that actually make an impact. So going forward, midterm, I think that we can look at increasing locational access to healthcare facilities. It's not enough to have a dispensary in an informal settlement. It's not enough. Even a basic healthcare, primary healthcare clinic is not enough. If you walk into an informal settlement and you see the way they live, you know that indeed, if these people, if there's any recorded case of COVID-19 in any informal settlement, and that person, interacts with anybody, more than 80% of them will be affected in the shortest time. And you can imagine what that would do, because these people move out, so there needs to be more effort in terms of healthcare facilities or healthcare workers interacting with these people, helping them to understand the impact of what's going on currently. And also that, leads me to WASH programs, that's water sanitization and hygiene. Right now is the good time or the best time to, improve such or to promote such programs. We cannot overemphasize it. So the community I went to, one of them, They have only 3 boreholes. And now, only one of that borehole is free for people to access water. The other 2, you have to pay to use it. So in a settlement of over 30,000 people using 3 boreholes, I leave it to your imagination to think of what would happen if one person should be infected with the virus. Everybody trying to use the water facility, you know. Of course, we need to also pay attention to partnerships, you know, for integrated actions and coordinations. Now is not the time to have things done disjointedly. Oh, one person is doing this project, another person is doing that project. It can even lead to duplication of efforts, which will not even give us kind of results that we're looking out for. So partnerships, a coordinated system for the actions that need to be employed is really key. Then going forward to long-term intervention areas, of course, inclusive planning and management frameworks for informal settlements. We cannot overemphasize that. The era of demolishing informal settlements because they pose seemingly like a nuisance to the community is gone. These are human beings and they deserve, you know, the respect of every other person living in the city center in terms of how their communities should be. You have to involve them if you're going to make changes, if you're going to bring about development. You have to involve them in the process so that you hit the hammer on the nail, or you hit the ball on the point. I don't know how to say that phrase, but you get straight to the point in terms of providing what matters to them. Also, leadership capacity, you know, for local actors, such that they have the confidence, they have the skills on how to present their issues to government bodies, authorities, who, you know, can then bring the change that they seek in those communities. Of course, adaptive policies and control strategies. In these times, you don't say, okay, because this is what we have mapped out for XYZ communities, this is how it will be. No, you have to keep changing until you see what works. I mean, when the COVID-19 pandemic started, we could see governments of different nations, you know, trying out different strategies and seeing which one works. At first, it was social distancing. Now it's no longer called social distancing because we understand that it's not actually social distancing, but physical distancing. At first, they said, okay, wear the masks. And then we realized that, okay, you don't have to wear the mask every time, everywhere. When you're in a group or a space with people who are talking or sneezing, is really important to do that, but you can't wear the mask sleeping, you know. So all these adaptive policies and control strategies are things that we need to be seeing, you know, going forward by, you know, implemented by governments, civil society, development organizations, and anyone who cares, you know, to bring about change in this period. So I'm rounding up now. I know I've taken quite, you know, a bit of time, but I'm rounding up now. So this is just a snapshot of some of the communities I visited and some of the people I interacted with. So the Soka settlement along Airport Road, Gosa Village, and Wansayawa, that's an Akko estate along the Airport Road as well. And these are some of the people that I interacted with. So I'm going to leave you with some of these thoughts. Now, the provision of relevant spatial, social, and public health infrastructure is really key. Now is the time for us to revisit and rethink some of these things. You can't just say because they're informal settlements, the best thing you can do is to find a way to keep them where they are. I mean, one of the days I was driving through the Airport Road and I saw that for every informal settlement that was close to the road, it was fenced. And I asked one of them, I said, who fenced this community? Is it that they don't want people to see you people because your community is, you know, is disarranged, is, you know, scattered and crowded? And he said, no, that what he knows is that they did that so that they would know where not to cross the boundary and come forward to the road. That's not good enough. We need to start thinking of what infrastructure can we put in place? What structures and systems, spatial designs can we put in place? Because these people are not going anywhere. They are not, if they leave that settlement, they will look for another settlement to settle. So why don't we now begin to think of what kind of housing system can we put in place that will still be, you know, okay for these people? I know people will raise the issue of, can they pay for it? Can they maintain it? But that's where the idea of social housing comes in. You know, not everybody will be able to afford their housing at the first instance. But there are systems you can put in place that can help them over a period of time integrate such housing schemes or housing plans with infrastructure, good roads, access to water. Most of these informal settlements are not connected to water systems, So let's move on. Of course, the water sanitation and hygiene condition needs to also be improved, especially during this period. And critical for me is the issue of data. If we don't have the right data, current data on these settlements, and the health status, the economic the economic data of people in these settlements, the general demographic data, we may not be able to design the programs that will meet the need of these people. So improving data for monitoring responses in these settlements is critical. And like I mentioned earlier, coordination from the local governments, the different authorities, the civil societies, the development agencies is really key. We don't want, disjointed efforts in trying to win this battle of COVID-19. And to end it up, I will just say that interventions at this stage must be balanced and holistic. Public health interventions cannot stand alone by themselves because it's public health. Interventions, economic or social interventions cannot stand alone by themselves. So everything has to be balanced and integrated in such a way that you're having a solution that is touching the different pain points of the people who are involved. On this note, I just want to say a big thank you, Modesta. Thank you for the opportunity to share my thoughts. And I look forward to the questions and the comments. Thank you.
Wow, thank you so much, Mary. That was an awesome talk. I know we all have comments, we all have questions, but for the sake of time, we still have two panelists that will come up. So we'll quickly run through the next two panel sections and we'll come back to the questions and answer section. But before then, I have a question. I'm actually going to do a poll after this presentation, after this section. So you all get ready. But I have a question. So how many of us here have been denied light, electricity, or have been asked to pay an additional rent because of COVID? Please put in your comments on the chat box. We want to know how COVID has actually affected you personally, maybe in your house, your neighbor's house, or maybe a story of someone you know. We'll be reading those comments here while I call on the next guest. So our next panelist is Theophilus Aristarchus Damak. I'm sorry if I've murdered your name again. I'm notorious for that. So Theophilus is a teacher by profession, and he has a Bachelor of Education technical degree from Ahmadu Bello University. He also has a Master of Art degree from Daystar University, Nairobi, Kenya. Theophilus has been working for NGOs since 2001. It is good because you're going to have the perspective of someone from an NGO. So, and his passion started from when he joined the Habitat for Humanity in Nigeria in 2001. Habitat for Humanity is the largest housing NGO in the world with presence in over 100 countries of the world and is based in the USA. So Theophilus worked as a program officer at the Habitat for Humanity. Then after that, he moved to the Fuller Center for Housing in Nigeria. It's called the Millard Fuller Foundation. So, and he's been working there as a senior program officer before he became the national coordinator in 2014. So his work in the organization spans over 15 years. So he can proudly say that he has worked in the housing sector for over 15 years. That's a good one. So his role covers a range of activities from fundraising to family selection, homeowner education, and he does this by organizing equity programs and education seminars. He also helps to oversee new community formation processes where bylaws are democratically created to facilitate mutual coexistence among homeowners. Theophilus, I must say all of these achievements are a mouthful. So we'll call upon you now to tell us more about what you do in your NGO. Theophilus actually has a video to share, so I will let him share his screen now. You have the floor, Theophilus.
Thank you very much, Modesta, for the opportunity to share my thoughts. The video will come at the end of my presentation. As she rightly pointed out, I am a teacher by profession that has delved into the housing sector. Basically, our presentation here are twofold. Jonathan will handle the second and I will handle the first. The first deals with the role of housing in managing disease outbreak in programs available in the Millard Fuller Foundation to help this. Jonathan will handle what can government do to support private sector in developing affordable housing for the most vulnerable and undeserved people in informal settlement during this pandemic. So we have 10 minutes each to do this. So a brief about the Millard Fuller Foundation. The Fuller Center for Housing is registered in Nigeria actually as the Millard Fuller Foundation because we couldn't register the name Fuller Center. We are an affiliate of the Fuller Center for Housing, Inc., USA. We began operation in Nigeria in 2006 as a housing non-governmental organization. We started building houses, just basic housing, a studio apartment that has a kitchenette and a bathroom, and sold that for just 250 is 40,000. Our mission is to provide on a sustainable basis affordable housing for all people in need by promoting collaborative and innovative partnership with individuals and organizations. It will interest you to know that the Millard Fuller Foundation is the most affordable housing provider in Africa. Olarewaju actually mentioned something about the affordable housing finance in Africa. They actually conducted a research in the whole of Africa and published that Millard Fuller Foundation builds the most affordable housing in Africa. So also the Millard Fuller Foundation is 3 times winner of the most affordable housing provider at the Abuja International Housing Show. Very nice credential for our NGO, isn't it? Now, my role is very simple, to talk about the role of housing in managing disease outbreak and programs we have in the Millard Fuller Foundation. I'll speak very little. My video actually speaks volume. So I have a story to share that speaks about housing managing disease control. In 1826 and 1852, there was a cholera outbreak which affected Asia, Europe, and America. That is generally known as the cholera pandemic of 1826 to 1837. In 1831, Kuwait was affected by this outbreak. 60% of the people in Kuwait died, but one family in the eastern part locked their doors, refused entry to anyone, and they didn't go out either. However, the wife of a son in that family insisted she must go see her family and made her way via the roof. She found all her family members dead. Then she decided to return to her husband's house. When she came, the mother of her husband refused to open the door for her, and she died on the doorstep there, unfortunately. So after the infection was over, they were the only families that were saved in the eastern part of Kuwait, out of the whole of that population in the eastern part. Just that family survived. And the only reason that they got saved was because they locked their doors. No one came in. And the only one that left never came into the house, and therefore everyone in the house was protected. That is the beauty of home ownership. You have a house, you are protected from predators, diseases, and COVID-19 inclusive. A survey was published by Habitat for Humanity that if you have a concrete floor, it reduces the spread of respiratory disease and parasitic diseases. And that if you repair a leaky roof, it eliminates mold. Creating access to basic sanitation facilities such as toilets and latrines helps improve hygiene and stops life-threatening diseases. We know all of these surveys. They are all over the place on the internet. You can find them. How housing has been of great help in preventing diseases. At the Mulad Fulak Foundation, what we actually do before handing over keys to our homeowners is that we organize an education seminar where we teach our homeowners to be basic hygiene of how to care for their bodies. Doing that actually helps in preventing diseases from attacking the homeowners, and it improves on interpersonal relationship. And we also do education about environment, which teaches homeowners about proper waste disposal, maintaining green areas, and keeping surrounding clean at all times. We also do basic housing maintenance, where we teach them how to care for their houses at all times and keep the value of the houses high, so that at any time they want to dispose of that house, the value of the house will be good in the market for prospective buyers to pay for. So basically, at the Mulad Foundation, we get homeowners from all walks of life. And I tell you that once I share this video with you, you will see all that we do to help the informal sector, especially to get access to decent shelter and accommodation. I'll share the video now.
Africa is a continent rich with opportunity. And when business and communities come together, its astonishing potential begins to be felt. The Sustainable Development Goals steering these partnerships, Africa's future is being rewritten with innovation, foresight, and inclusivity. Crossing the length and breadth of the continent, our journalists uncover these stories and share them with the world. Join us now for remarkable stories of partnerships across Africa, building the future and changing lives. It's Africa's time.
Nigeria requires 16 million new homes to meet the immediate needs of the people, the vast majority of whom earn less than $4 a day. Masaka in Nasarawa State is a typical informal settlement and a reflection of how many poor Nigerians live. Structures are haphazardly erected with no forward planning. There are little or no public services. Landlords often own whole compounds and offer little support to residents. Solomon Madaki first lived here when he arrived from Kaduna State looking for employment.
Masaka is no address. No address. Very complex. When I was here, I had to park my car very far away from my house because no road to the house will be come. So I will show you where I live before. This is the main compound where I was living. Like here, I was the one that made this bacha. It's just like a kitchen for me. This is the toilet. So this is where I stay before. As you can see, it's not normal person that will live in this kind of a house that will tell you that, I'm comfortable. It's not comfortable.
Solomon found a job as a driver with the Millard Fuller Foundation, an organization that focuses on creating affordable housing for the masses.
We provide affordable houses, not like a man that want to make money, we come and buy an estate. So no, we don't build house for such people. We build house for people that are in need.
With Nigeria's population predicted to double in the next few decades, low-cost affordable housing for poor communities is set to become the fastest growing sector. The Inclusive Business Action Network, IBAN, is a global multi-stakeholder network unlocking the power of inclusive business. The My Home, Your Business affordable housing sector dialogue brought together a range of industry players to promote partnerships in the BOP market.
Housing is a multi-stakeholder approach, so you need access to land, you need access to finance, you need somebody who provides a technical solution, you need somebody who will buy the house. So from my point of view, a public-private partnership model is one of the most promising vehicles to drive affordable housing.
I think in affordable housing, there's special kind of entrepreneurs that are needed. We need the persistent type, the creative type, the ones that are able to push business or dreaming. So it's not the average entrepreneur, because lots of money to be made in affordable housing, but it's not tomorrow. So you have to have these kind of people that can see the long vision.
For Sam Odia, the housing crisis is more than just a business opportunity. It's a calling.
Faith is very important to me. I realized that I had a ministry of housing to work on. And that was strange to me because I never really heard of that sort of ministry. I'd always imagined a ministry behind that. Things have to change, and I think the best way to begin to make that change in a small way in your locality. That's what we're trying to do. It's very easy to make policies somewhere in the middle of town when you're not seeing on a daily basis the real need of the people. We see those needs because of where we're located.
For decades, government housing providers and developers have built homes for practically everyone except the poor majority. Sam Odia and his architect wife Funmi believe that by operating in this vital yet underdeveloped and unpopular space, social change and business value can go hand in hand.
We have a very large percentage of poor people in Nigeria, and it's a shame when in a country as big as Nigeria with 160 or 70 million people, you are excluding 90% of the population government programs.
Sam and Funmi are passionate about finding creative housing solutions that bring dignity to families who live in poor and congested conditions.
We're not interested in building luxury housing or even housing for the middle class. Our intention is to build houses that are hopefully affordable to a lower end of the market. A lot of challenges. Housing finance is a really big one. Even people who earn enough money to pay a mortgage usually have difficulty building up the deposit.
This housing project in Luvu, Madaki, Masaka, outside Abuja, has been designed to allow first-time homeowners to expand and to grow their homes as their means allow. A basic one-bedroom or studio apartment shell is provided, which can then be further developed.
We would call it incremental housing, and the whole idea is that you might not be able to afford the entire house, but it's much easier for you to afford a smaller unit, and when you finish paying off that unit, you can then expand and put the additional room.
People live in unplanned settlements. It results in chaos. It needs intervention. The environment needs to be planned, it needs to be ordered so that people can live, better lives.
For those trapped by poverty, owning their own home seems like an unreachable dream. Solomon realized that he could have a different reality. With the help of the Millard Fuller Foundation, he managed to put a finance plan in place and is now a proud homeowner.
This is my new home. This is where I live now. And this is my beautiful daughter. This is I and my wife. This is the size of the kitchen. Aidama burin namiji shine ya kasance yana da gida, yana da kuma abin da zai iya ba ma iyalin shi don su ci. Baka da gurin kwana, baka da abincin ci, ai baka cika mai gida ba kenan. Idan kin duba kamar yanzu nan haka, zan iya kulle daki na yi tafiya ba mai ce min ina za ka. In na gan dama in dawo karfe 30 ba mai ce ina ka fito domin mai gidan nawa ne ko ba haka ba. Yanzu da ni na fita zuwa nan sai abin ya zama min kamar al'ajibi.
Another resident whose life has been transformed is Esther Uluwele, a single mom and teacher who was living in a one-roomed mud house with her 4 children. Esther joined a savings scheme and with additional help from her church managed to raise the deposit. She's now paying off her own home.
Ó difficult fún àwọn èèyàn láti rí ilé níbí ní Massa camping especially. Wọ́n mind bóyá fresh air wà or no fresh air. Wọ́n kàn build anyhow. So àwọn èèyàn suffer gan. Inú mi dùn púpọ̀. Gbogbo ìyà tí mo ti jẹ torí landlord problem. Mo ní freedom from landlord. So kò sẹ́ni tó ń disturb mi. Ilé náà ó bò wá láṣìírí gidigidi gan.
I'm excited about seeing environments change, seeing a dream come true. Lives are changed by that process. So it's social engineering, really. You're engineering people's lives through good structures. So that really excites me.
Hi. Yes, we can hear you. That was an awesome video. It was good to see the impact that the foundation is making in people's life. Thank you so much for that presentation, Theophilus.
Thank you very much.
Because we have run short of time, we will invite Jonathan to give a few remarks briefly. We are dying to go into the comment section, and I know everyone has something to say to you. So we'll ask them to hold that thought, and we invite Jonathan. Jonathan Anaja Matthias. He's a project management professional from Global Project Management Institute, PMI, in USA. He has had a lot of experience working with housing and different architectural projects. So for the lack of time, I'll invite him to give his own remarks briefly and tell us some more about all of this beautiful work that he has done.
Hello, everyone. Can you hear me?
Yes, we can.
Can you hear me?
Yes.
All right. Thank you so much, Modesta, for this opportunity. I won't bore us with details of anything about our organization. Theophilus already did that, but of course, I am the project manager for a lot of the works that Millard Fuller Foundation has done between 2014 and now. So, but what I'm going to do here is, I think my 3 major assignments is to tell us who the undeserved and the vulnerable, who they are. Let me just share something I have that will just guide me to be able to just wrap up this presentation in good time. Now, we know already what we're talking about, but what I'm facing, basically is what can the government do to support the private sector? We've been doing this on our own, but there's less you can do without actually the government coming in. Architect Olanrewaju said a lot about policies, but I will just quickly go into these informal sectors are, and then just make some few remarks, then I'll close up. Now, the informal sector, basically, they actually termed the unbanked. The truth of the matter, like Architect Olanrewaju said, is they do so much to the economy, they do so much to our GDP. If I'm not wrong, I think about 65% of our nation's GDP comes from the informal sector. But yet, these are guys that it looks as if nobody wants to do anything for. In short, when we approach financial institutions to say, we have these guys ready to take up our house, give them facility, they will tell you they are unbanked, they don't have their data, how will they get their money back? And so these guys are just frustrated, but there are a lot that we can actually do to help encourage the private developers to do a lot of things. Now, I have this pyramid here I'm going to share with us. Now, if we can see what I have there, let me see if I can, okay, enlarge it a little. You can see this pyramid I have here. You can see that those in the informal sector, the people we are serving and the people I want to talk about, they are the people at the bottom of this pyramid. If we can see, they make up about 78% of the Nigerian income population. Now, these guys earn less than 500K annually. I'm talking of people who earn 18,000, 30,000, 40,000 per annum, per month, beg your pardon. Now, these are the people that I see as the underserved when it comes to housing in Nigeria. And these are the people that this pandemic is hitting the most because they don't have access to finance to be able to own their own homes. But there is a lot the government can do. Now, I have done an analysis here, and I have said that I have come up with this analysis. It says that the cheapest house that has been built by a private developer in Africa, according to a recent survey by the Center for Affordable Housing Finance that Architect Olanrewaju, he quoted them earlier. They said the cheapest house in Africa right now is 3 million naira. Now, this house was built by the Millard Fuller Foundation. But the funniest thing is, even people who can afford these houses are not even anywhere close to this informal sector, the people at the bottom of the pyramid. Now, the truth of the matter is, if any of these people can afford this, they will need to be able to pay 10,000 naira monthly for 25 years at a zero interest. Now, that does not exist anywhere presently in Nigeria. The reason is because nobody gives a mortgage for zero interest. Nobody wants to give them as long as 25 years to pay because they feel they're from the informal sector. Now, even as cheap as this house is in Africa, people in the informal sector cannot afford it. Now, what can they afford? What must the government do? The government needs to be very conscious in their planning. Now, I won't go into details of the importance of the, this informal sector because Architect Olanrewaju already touched on that. But the truth of the matter is, if the government wants our economy to thrive, and if they want to solve the housing deficit problem, we need to consciously and intentionally think about these guys. Now, the big question is, what can the government do? Now, number one, there are what they call the formal sector underwriting standards. That's quite clear. But there is also what they call the informal sector underwriting standards. Now, the informal sector underwriting standard, if you look at it critically, personally, to me, it looks like an academic exercise where you already from the beginning know that the people in the informal sector do not have the kind of data and requirements you are asking for to give them a mortgage. So it's like cutting them off even before they begin asking for a mortgage. Now that needs to be rewritten. Now, I noted something here. I say long-term rental may be the way out, really. Now, the cheapest mortgage in Nigeria right now, I think, is the one from the FMBN, 6%. But do you know that even for 25 years, somebody earning 18,000 naira can only afford a 1 million naira house? It goes to tell me that the government needs to help the private sector bring down the cost of house. Now, this is where I am going to focus my attention on. Like I said, I skipped a lot of slides so that I won't repeat what others have said. Now, do we know that if from the houses we have built at our organization, if government does something about land in this country, cost of a house can go down by 10%. If government does something about infrastructure, basic ones in this country, cost of house can go down by 15%. That's 25% of the cost of house if government comes in these two aspects. But most time we have discovered that government have come to us and said, oh, you are an NGO, let's give you a land. But those lands, when you step into it, you see government wouldn't pay compensation. And before you know, people carrying machetes are chasing you off the land. Now, if we can solve this, 25% of cost of house is gone. Now, there is another big problem. I mentioned the tax relief on building materials. Do you know that tax has just got up from 5% VAT to 7.5%? Do you know that there are countries, a good example is Kenya, who give tax relief to developers doing affordable housing? Now, if we have to buy material and a 7.5 tax has been paid on it, and the homeowner comes to pick up the house, and he also pays a tax of 7.5%. Do you know that if this relief is given, that's like a 15% load of cost of the house lifted off the shoulder of these, homeowners. Now, these guys will not come near some of this decent housing that we are talking about here if they know that all these costs are being taken into account. Now, Mary said something that struck me very much. She talked about inclusive planning and the management framework for the informal sector. We know that the informal sector, they are doing something on their own. They build their houses incrementally. They get lands through cooperative. They start foundation. They put one room. They expand it. But what do? We don't even allow them to register their land because we say that the title on the lands are not correct. Now, what am I saying? Am I saying we should register lands or build shacks? No, but the thing is this: if there is an existing framework that is working for these guys, why don't we carry them along? And so instead of reinventing an entirely new thing, study, like Mary was talking about, study how are these guys doing these things now? Why don't we create a framework that we allow them, register, accept the title of their land? There are local government titles. There are rights of occupancies that we can actually accept to get their houses into the database, but we don't accept it. Now, if government recognizes the existence of this informal sector and they contribute so much to the GDP of this country, and they make this much population, I think 83.2% was what Architect Olarewaju's presentation quoted, of the 81 million workforce are from the informal sector. Do we know how much of our economy we can boost if we expand our net to drag these guys in? Now, government needs to look for a way of working the way they are working now. Let's accept the way their land is. They get it in bid. Let's do them incremental houses, and then the long-term framework, Mary was talking about, I have something on the screen. I said we need to decongest the densely populated informal settlement and re-engineer the slums. Now, long-term, government shouldn't just wake up and say, you informal guys in this settlement that they wanted to do with Pape, get the hell out of there. Now, we need a long-term plan to build an alternative. Now, if there is an alternative built by first studying how these guys are living now, build an alternative
we have a break
for them and say, no, come, you guys, I have this beautiful canteen to be able to. Hello, can we hear me? Hello, hello.
Yes,
hello.
You have 1 minute to round up, please.
Yeah, I'm rounding up. I'm rounding up now. I'm already done. Okay, so if the government can really take care of the cost of the houses by removing some of these percentages I was talking about, if the government can provide how do we call it, alternatives for decongesting the slums, and the government can look at a program where you study the way they work now and then take it from where they are, it will go a long way to help in, an inclusive package for the informal sector. All right, thank you very much. Let me just rest my case.
Thank you so much, Jonathan. That was insightful. Unfortunately, we didn't have enough time to let you go through all your slides. So we'll take more of getting questions and comments, and anyone who wants to reach out to learn more could actually reach out to you. We have a lot of burning questions here. First of all, I see all your comments about how COVID-19 has affected you personally. I see architect Olarewaju, I'm sorry, I keep merging your name. Architect Lanre, can I call you that? Yeah. So he said he pays about 100% extra of electricity. A lot of people here are talking about electricity. But Father Augustine Nwabara has had a lot of questions for all of the panelists. So I want to give him the floor to ask the questions. And please, Father, keep it brief, 5 minutes.
I pray I will. This is really interesting. I have so many burning questions about Jonathan and Theophilus. Please, you have to make this comment. It's obvious the government has failed us. How can individuals help? And how did the people that got this, the beneficiaries, how did they get at it? You just help us to narrate that story later. Then on what we are trying to say, we've been calling informal sector. At the back of my mind, the informal sector have actually become a formal sector in Nigeria. I observed something in Abuja. The main city of Abuja is empty. People don't live there. So many people have moved to where we call hubs to secure themselves. So what can we do to help this situation? Another thing here that came up in all the conversation is taxation. I was fighting this when I was in Nigeria, when people say Nigerians don't pay tax. It's a lie. We pay more tax, especially those in the informal sector, pay more tax than even those in the formal sector. Example is the keke rider in Nigeria. He spends over 200 naira every day, and he pays every police checkpoint.
Yes.
And police people are representatives of the federal government. And if if I give money to a police person, I should file it at the end of the year. So because it is a task that I need to account for. And as you rightly said, architect, these people are left out at this point. Another thing I have here that we also have to talk about is when we talk about essential services. Actually, we borrow a lot of things. And when we borrow a lot of things, we don't classify it. What do we call essential services in Nigeria? Where every individual works out what he earns. Over here in America, you can talk about essential services because people are providing for you. Every one of us that have been here will realize that not even one thing has been added in the value of the price. no matter the scarcity. When I went to the supermarket to buy Walmart to buy something, I realized that what they were giving buy one take one, they remained even at the demand of that particular good. So when we in Nigeria, where according to the governor of Cross River State, where the government does nothing for individuals, what do you call essential services? Because if the government gives me nothing to feed, why wouldn't I go out to work? So that's another thing I want to talk about. Then the issue we have here is about pandemic. One, when you classify a sickness as pandemic, every one of us are paying for those who have contracted this sickness. You are paying for everyone that is suffering from this sickness in Nigeria. And when I pay for it, there should be an account. So that they come and tell you HIPAA law does not work out here, because if I am paying for it, you give me account. As Mary said, one of the problems we have in believing this is that they don't give account. Look at all over the world, people that have suffered from this sickness, they give account. You trace it. But when you hide them, you say that the HIPAA law says you don't do that. No, that is not applicable in my own knowledge and in my own understanding. And also, you better talk something about data. But another thing we have to talk here, we are trying to raise up ideas. We'll talk about rent. How come the government cannot take your rent from your monthly allowance? Because they know they don't pay salaries. Because if they pay salaries, they can tell a worker at the end of your month, we deduct your salary, we deduct your house rent. Over here, you know that your employee can actually pay directly to your needs. So how do we help? How do we communicate this? I have the belief that Nigeria has failed us, but Nigeria is workable. If we turn the engine today, if in 10 years, Nigeria will become the center of attraction to the entire world. Thank you.
Thank you further for those points. So I believe the panelists have the responses to some of those questions. I think we should all take the questions once so that the panelists will answer them all at once. So we have Antimoji raising her hand. Antimoji, please, you have the floor.
Thank you very much, Modesta. I think we've had a very robust conversation on shelter and the impact of shelter on COVID-19. And I think that we should take this forward. It should not be a one-off thing. I was checking through the number of attendees or participants. I see that we didn't quite do a lot in terms of networking so that other people can join. This is so important. As I speak to you, I'm in the UK, but and during the lockdown, homeless people were looked for to take them off the street, to bring them to shelter. Shelters were created for them so that because they are vulnerable, some of them have illnesses which will make them vulnerable to infection. But government took a bold step by going after homeless people. I think these are some of the take-homes that we should apply and listen to. And if we have journalists amongst us, these are reports that we need to carry out. Let's do a quick research. Let's go to the streets and find out what has happened to all those homeless people around us. How have they fared? What palliative were sent to them, if they got any? Because if I'm homeless and you give me rice, where will I cook it? If I'm homeless and you are asking me to wash my hands frequently, where do I live to get the water? But if there's a community of shelter, then the basic things that we are asking for will be provided. But has this been provided? These are some of the post-COVID-19, God helping us, that we should really pursue, so that I know that sometimes people are wanting to say, oh, government can't provide everything. Yes, government can provide, but this should be a springboard for development. And I think our very, very first speaker and our lady and all of them together emphasize the need for us to see housing shelter as part of public health provision. Some people really can't afford because they are not gainfully employed. So they cannot afford to, they cannot afford to pay their rent. What are landlords doing? In other parts of the country, we're hearing landlords that are giving some grace of months. Some governments in other countries are even saying that for a period of a year, landlords should not ask for rents because people have not worked. So where will they get money? So a whole gamut of trauma surrounding shelter and COVID-19 and going forward, even post-COVID-19. And even in our country, at a point, I don't know how far it's true because I haven't investigated and haven't seen, but I'm asking journalists to go. Now, speaking of Almajiris, we see them all over the place. We hear now that they are transporting them in huge numbers to other parts of the country because we don't have the social safety net where these people can be. Going forward, I can say to you that ISMPH will continue to support and amplify this. And Modesta, this is something that we have to, this conversation must continue. It's not a one-off. It's an everyday need, shelter. So I'm hoping that we'll continue with this so that we can stimulate communities coming together themselves to build. And this is where architects should come in. Architects should start researching on our local materials that will make housing affordable. It doesn't have to be a mansion, for crying out loud, but it's just that you'll have, at least you're secured, you have a roof over your head. I could go on and on and on. You know my passion, so I'll stop for now.
Well, thank you for those wonderful comments. I mean, interestingly, we had over 150 people register for this webinar, but then when we started, we had a Zoom bombing, so a lot of people dropped out. But yes, like you said, we have a lot of role to play. I see Omar is raising his hand. Omar, if you have a burning question, please ask, and the panelists will answer all your questions at once.
Thank you, Modesta. My name is Umar Farouk. I'm also an architect, and that's why I find the meeting quite fascinating. I just want to start by what the last lady talked. She mentioned 3 points which really touched me. The first one was we agree that government can provide everything. I think even such cliches need to be reviewed in our minds and our consciousness. In the first place, anybody who wants to come into the government, they go to your doorstep and ask you to vote for them, that they will do everything for you. But when they come into the office, they now start using this same cliche. You know, government cannot do everything for you, so you have to do. Who said that government cannot do everything for you? Of course, government should be able to do everything, because everything means giving you also the opportunity to contribute to your country.
We see Father clapping to that.
Yeah, yes, Augustine definitely would agree with that. In the USA, that's what they do in so many of the states. Where I am here, they also do such things. I'm in Malaysia, and I know, and I see, and I live within what they are doing, and I'm also benefiting from it. And that is why I'm saying it is really sad. It's really annoying for any politician to stand in front of me and tell me, you know, government cannot do everything, so you also have to. No, I voted you to do everything for me. And that's why I pay tax. That's why we pay TAX. Now that's one. So please, let us leave that out of our minds. We should start kicking that out of our vocabulary. Government should be able to do everything for us. Then the second thing she mentioned about research on local materials. That's quite interesting. Architect Olarewaju will definitely know about that too, and other architects in here. I mean, as at now, we do not need any more research. we have done enough research. Believe me, we have loads and loads of research in our institutions of learning, even in our polytechnics, not just the universities. We have researchers there that they have been sitting in the archives, gathering dust. So what we need to do is bringing in the institutions of learning and now going into development, not just research, because that's what we just keep taking our time on. Research, but we're not going into the D, which is development. So we don't need to do research. We already have enough researchers, and we can even borrow other researchers from other countries and just move on. Let us not be backwards. Then she also mentioned something about mansion. It's not that we, look, we can use our local materials since it is not mansions we're looking for. No, actually, personally, and I know Architect Olaronju will agree with me, I want a mansion, and I know with local materials, I can achieve a mansion. In fact, as at now, Augustine may even know, because in the US, there are so many mansions, really quite expensive mansions, being built with, incorporating local materials. And when I say local materials, I'm talking about the real local materials, and that's clay. Clay bricks are being used to construct very exquisite, houses. But that's for the rich, of course. And I know we are now talking about how to give housing for the more than 80% informal Nigerians. And I think one of the ways we can also do that is, when I look at the more than 80% of us, because I'm also one of them, I noticed that the government can do a lot of things. And when I say the government, I don't mean just the federal government. I mean federal government, state government, local government, the councillors. In fact, the Ungwa can do a lot also. So they are all to be blamed. So let us not just be looking at just Buhari. No, Cross River, Borno, all these governors, all these houses of assemblies, they are also, part of the problem. And so, and that's why I found what Senator Mitt Romney in the US, one time he was championing this bill for this COVID-19, that every essential worker throughout this COVID-19 period would have to be paid $12 per hour for about, I think, 2 months. And he said that the way it would be done is that the government will give $9 and the employer of every essential worker at the bottom of the ladder will now give $3. The $12 will now be paid to these people. That's us in the case of Nigeria. But, sadly, I don't see any senator, any representative, anybody in the houses of assemblies coming up with such positive and deep thought solutions. Are they not there? Each one of us here, all of you, you have representatives in the House of Reps. You have representatives in your houses of assemblies. What have they done to us, the 80% plus informal housing? So I think, people are just sleeping up there. And while we do meetings and gather ideas, I noticed that we hardly take up these ideas and give it to them, because now that's why I'd like to submit that the result of this talk we are having should be well packaged and given to all these people I've mentioned, right from the houses of assemblies up to the federal level. It will definitely go a long way, and using our professional bodies, of course. And then lastly, I would like to say that Theophilus and the other man, Jonathan, they are really doing a good job, by developing for the 80% plus. And I keep repeating that I'm also one of them. But really, unfortunately, I still cannot afford the 3 million house. So I am now trying to advise that perhaps Theophilus and Jonathan and Mueller Foundation can look into the use of this local materials that was mentioned by the lady. We can really use these local materials to get the cost of their affordable housing quite lower than that. And then they will now keep holding the record for the most affordable housing, in Africa. I really pray and hope that they will do that. Thank you very much, Modesta, and thank you very much, the other participants.
Thank you so much, Umar, for those wonderful remarks. Actually, you've made a very good recommendation, and I'll take you up on that. The YouTube link for this recording, at least actually it's live on Facebook now. So I'll share the YouTube link with all the participants and make sure that you have access to it to share to whoever you want to share with. So I know, Architect, you have some final words for us, as well as some other panelists. In 30 seconds, please give us your final words and tell us how to reach you so that we can continue this conversation. Meanwhile, while you're making the final comments, I'd love to launch a poll. You should be able to see it on your screen, and we'll get you to answer some of these questions as a feedback from what we've reported today. So, Architect, you have the floor. Okay, you're muted. You are muted. Unmute.
On mute. Okay.
Yes. Mm-hmm.
Can you hear me now?
Yes.
Okay, so I was saying thank you very much, and for everyone as well, thank you. Now, I really, I'm short of words right now. I think we should go back home and take to heart what we have all mentioned here. Antimoji has said quite a whole lot, in the areas of the kind of things we have presented in our papers. My discussion is quite robust, because it took me about a week to put all of that together. And I like what Umar Farouk had also done, more like an executive summary of everything we've all said, Augustine, myself, Mary, and the Millard Fuller gurus. I've heard about you many times. Some of your architects are my colleagues as well. So I would not add anything at the moment, but to say that if we can put together a communique of all of these that have been mentioned here and the proposals that we have put together to bring out the problems and solutions to these problems in these areas of informal settlement, which Augustine says should now become the formal settlement, as it were. I think if they could get to the right quarters in government, government is there to provide the enabling environment for us in the private sector to be able to make any contribution. We cannot do anything if government does not give us that enabling environment. Thank you very much.
Thank you so much. Do we have another panelist willing to make his final comment? Theophilus and Jonathan. Okay.
Yeah. I'd like to make my comment. As mentioned in the Millard Fuller Foundation, we are not relenting at all in meeting the needs of the low income. As our video has rightly positioned what we are doing. We keep pointing, accusing fingers at government that they need to do A, B, C, and then yes, government truly has failed us to a lot of extent when it comes to issue of housing. But at an individual level, really, what do you call them? Homeowners, landlords. If they can subsidize housing, when the cost of packet of Omo was not affordable to the poor, what they do, they decided to make it into sachet so that it will be affordable to the poor. And so we have to look at housing in that light. For that person who goes out to fend for economic survival on a daily basis, we have to make like the payment of the house maybe on a weekly basis, monthly basis. If you look at the cost of housing on an annual basis, some of the landlords will ask for 2 years ahead. That is making housing really not affordable to the low income. So we need to really look at how we can sachetize housing. For ownership, you don't have to really begin to own a house with a 2-bedroom, 1-bedroom sort of. You can begin with that single room like we are doing, and then gradually expand as your income, increases. So that way, we can help ourselves without government intervention, really. But then also, when you look at the mortgage system,
I have to cut you short. I'm sorry. I'm sorry. I have to cut you short. We know that you have a lot to say. I'm so sorry. Yeah. We have run out of time, and a lot of people have to catch up in other meetings. So
it's okay.
Please let us continue this conversation on Facebook. We are on Facebook at International Society of Media in Public Health, on Twitter at ISMPHNG. Please drop your contact information there. Okay, so we have a poll going on here. We would love to hear your feedback. Unfortunately, we can't get Jonathan and Mary to talk again, but we have to end that.
It's okay. It's okay.
So please, let us continue this conversation on Twitter and Facebook. Thank you so much to our panelists. Thank you to our participants. Please, let's put our hands together for our good panelists. It was an awesome section, although we ran out of time. So thank you, and we'll see you next time. Bye-bye.
Thank you. Bye.
Thank you so much.
Bye, Modesta. Thank you.
Bye. Bye. Bye, everyone. Thank you for joining us.
Yes, thank you for having us.
Bye.